Hi, I'm Michael Hogue, the CEO of the American Pharmacists Association. I want to discuss the recent changes to CDC's Advisory Committee on Immunization Practices, ACIP. We appreciate you as pharmacists and pharmacy team members who've administered more doses of vaccines in the United States than any other healthcare provider. Pharmacists are one of the most highly trained healthcare professionals on vaccines and their use in patients across the entire lifespan. In many communities, patients, parents, caregivers, and other healthcare professionals depend upon your guidance for clear recommendations on the use of vaccines. Recently, HHS made significant changes to the way vaccine policy and recommendations are developed. For decades, we've relied upon a system leveraging the wisdom, knowledge, and real-world experience of experts in the fields of immunology, microbiology, infectious disease, medicine, and patient care delivery to evaluate evidence-based and credible science to make clear recommendations to healthcare providers and consumers on which vaccines are needed, when they're needed, and the risks versus benefits to individual patients and communities. This clarity based upon credible science is essential to preventing outbreaks of diseases that have been known to not just make people sick, but also to cause millions of needless hospitalizations and deaths. Let me be very clear. For APhA and the pharmacy profession, this is not about politics. We took an oath to provide the very best care to our patients. APhA is taking a stand today because what's happening to our vaccine recommendation system is casting doubt about science and is putting thousands of patients at unnecessary risk of potentially serious infectious disease. Balance and rigor have been thrown out of the window in favor of creating doubt and ambiguity in the long-settled scientific matters. In fact, at a recent ACIP meeting, the new committee chose to allow personal agendas and biases into decision-making. They completely disregarded a well-constructed, publicly available evidence to recommendations framework for decision-making. And frankly, the dismissal of the entire ACIP without cause and replacement with a small group of people whose backgrounds do not reflect the expertise in the subject is unconscionable. After decades of having the most robust vaccine use system on the planet, a system that most countries turn to for leadership and decision-making, America now has cast doubt and dispersion at a time when outbreaks of measles, pertussis, and other diseases are making a resurgence. As a result of this blatant disregard for science and process, APhA has made the difficult decision at this time to withdraw our endorsement of the revised ACIP immunization schedules. Pharmacists, as well as other vaccinators and the public, need timely access to vaccine recommendations that are based on credible science that are in the best interest of patients and public health. We've also made the decision to join the Vaccine Integrity Project and other coalitions to create a platform for making clear, science-driven recommendations on the use of vaccines across the lifespan. APhA is working with our national and state partners to make regulatory and statutory changes for vaccination authorities to no longer be solely based on ACIP schedules. We're already working with insurers to advocate for continued full coverage of vaccines. As a profession, pharmacists make millions of evidence-based decisions every day, and we encourage pharmacists to continue to make those decisions about vaccine recommendations. APhA will ensure that you have the best information available as new vaccines come to market and when there's confusion about the appropriate use for a vaccine. We have always been and will continue to be your trusted resource in immunization practice. Thank you for what you do every day to protect and improve the health of the communities you serve. For every pharmacist, for all of pharmacy, APhA is fighting for you and your patients. We hope you'll join with us as we stand for you. For more information, go to pharmacist.com.